If you have a condition where your blood doesn't clot properly, Amicar can help control bleeding. This may be necessary after certain surgeries or in certain conditions like bleeding disorders, liver disease, or cancer. Aminocaproic acid, the active ingredient in Amicar, works by helping your blood to clot normally. It belongs to a class of drugs known as antifibrinolytics. Be sure to follow your doctor's instructions for the best results. When taking Amicar, be sure to follow your doctor's instructions carefully. The dosage and frequency of taking this medication will be determined by your medical condition and how you respond to treatment. It's important to take Amicar exactly as prescribed by your doctor to get the most benefit from it. Do not skip any doses, and do not increase your dose or use it more often or for longer than prescribed. Your doctor will closely monitor you until your bleeding is controlled. If you are using the liquid form of this medication, be sure to measure the dose carefully using a special measuring device/spoon. Do not use a household spoon, as you may not get the correct dose. Let your doctor know if your condition does not improve or gets worse. If you experience headaches, stomach pain, loss of appetite, nausea, vomiting, diarrhea, unusual tiredness, dizziness, stuffy nose, or watery eyes while taking Amicar, consult your doctor or pharmacist. This medication has been prescribed because your doctor has determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it's important to notify your doctor if you experience a sore throat that doesn't go away, ringing in the ears, changes in vision, muscle pain or weakness, signs of kidney problems, confusion, slow heartbeat, unusual bleeding or bruising, chest pain, shortness of breath, or seizures. While very serious allergic reactions to this drug are rare, seek medical help immediately if you notice any symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Before taking Amicar, it's important to let your doctor or pharmacist know if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to inform your doctor or pharmacist of your medical history, especially if you have heart disease, liver disease, kidney disease, or any other blood or bleeding disorders. Amicar may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Amicar should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it's unknown if this drug passes into breast milk, so consulting your doctor before breastfeeding is recommended. When taking Amicar, it is important to be aware of the potential for drug interactions. You should keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Amicar include blood clotting factors and tretinoin. It is also important to inform your lab personnel and doctors that you are taking Amicar, as it may interfere with certain lab tests and cause false results. It is important to be cautious and communicate with your healthcare providers to ensure the safe and effective use of Amicar. Always follow the recommended dosage and timing as prescribed by your doctor. If someone has taken too much Amicar and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. If you're in Canada, you can reach out to a provincial poison control center. It's important not to share Amicar with others. Your doctor may also recommend certain lab or medical tests to monitor your progress while taking this medication, such as platelet counts, blood clotting tests, and CPK levels. Be sure to consult your doctor for more details on these tests. If you forget to take a dose of Amicar, be sure to talk to your doctor or pharmacist to figure out when to take the next dose. Do not take double the dose to make up for the missed one. When it comes to storing Amicar, it's important to keep it in a tightly closed container at room temperature, away from light and moisture. Make sure not to freeze it and avoid storing it in the bathroom. Be sure to keep all medications out of reach of children and pets. When it comes to disposing of Amicar, it's important to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.